The dentist with 2 state licensing violations.
And I wanted to give you an opportunity to have your voice heard in this story.
The patient put in harm's way.
He gave me something I wasn't allowed to have that could have destroyed my life.
The recorded admission.
I know what I did, I know why I did it.
And the whistleblower.
Tell me what you see here.
The guilt, it's consuming me. It is literally, it's breaking my heart.
He's a dentist, not a doctor.
It was September 2023 when Patricia Pachetti was seen by her dentist, Dr. Richard Charlap, on South Park Avenue in Lackawanna. She was in tremendous pain.
Tooth pain is the worst kind of pain anyone can feel. I would rather give birth 3 more times than have a toothache.
At 7 weeks pregnant, her first trimester, Patricia needed medical clearance from her doctor. Treatment was a go, but the doctor made it clear with this note, the dentist should refrain from prescribing epinephrine. And as far as she knew, Dr. Charlap did as told when using a local anesthetic.
I was believing I was getting a safe medicine for my child and myself.
That was until December, when she got a call from Carrie, the dentist's now former medical assistant. Carrie, who doesn't want her face shown, fearing for her professional future, explained the dentist gave Patricia exactly what her doctor said she should not have had.
My worst fear was I was going to call her and she was going to tell me, God forbid, she miscarried or something, but thank God she did not. But I want to make sure that this doesn't happen to anybody else.
That's why Carrie says she's coming forward as a whistleblower. She was let go from Charlap's practice in December after 3 years of employment. She says her time at the practice was coming to an end. The writing was on the wall. She felt the dentist knew. She was onto him.
We got really into it bad when I realized and confronted him on the fact that he had purposely used the wrong anesthesia on a pregnant woman.
That confrontation, in part about Patricia, was something Carrie recorded and shared with the 7 News I-team.
Dr. Charlotte, we had a 7-week pregnant woman who sent us had a letter from her OBGYN that we were not supposed to use epinephrine on her. And you switched the carpules.
No, I didn't.
Oh, you most certainly did.
Not that I recall. Oh, I know exactly what I did, Carrie. I know exactly what I did, and I know why I did it. Okay?
So you're saying I'm stupid?
No, you're right.
You heard Dr. Charlap admit he switched the carpules, these little glass tubes that are put in the injector, giving Patricia the wrong anesthesia. That recording 3 months before Carrie was let go. But the dentist had more to say.
Yes, I know what I did. Okay? I know what I did. I know why I did it. Do you know why I did it?
Why you use epinephrine when the paper said not to? No.
Why I used Septicaine instead of using Carbocaine, even though you had Carbocaine out.
You used Orablock.
That's Septicaine.
Right.
Articaine.
Right. Because you always taught me with a pregnant person to put the other ones out.
Right. That is correct.
Septicaine is a drug with epinephrine. Septicaine's own website has documentation explaining the product should be used during pregnancy only if the potential benefit justifies the potential risk of the fetus. Remember, Patricia's doctor said no epinephrine.
What I did isn't allowed. Okay?
I know.
Why?
Because the note said no epinephrine. Because she's in her first trimester.
Bingo.
Right.
Okay? But is it going to go do anything to the fetus? The answer is no. Okay? They just don't want us taking chances.
Right.
Okay? I used it because it gives a very profound anesthesia, which I needed to have or I wasn't going to be able to get the tooth out.
Right.
Okay? So that's what I used. Off the record. On the record, I have no idea what you're talking about.
You laugh at the end there. Talk to me about that laughter.
It was almost a nervous laughter, like a disgusted laughter, like you're crazy. Like you're literally out of your mind. Crazy that you would admit it, like you didn't even care.
I was betrayed.
But there's another problem. Patricia requested her medical records after that phone call from Carrie, only to learn the dentist documented using Carbocaine with no epinephrine. But on the tape, he admits to using Septicaine with epinephrine.
What I did isn't allowed.
Contradicting those notes.
Why are the documents not matching reality.
Dr. Jake Grossman is a practicing dentist and adjunct professor of dental medicine at NYU. He's testified in more than 1,000 malpractice cases, has no connection to this story, but in this instance raises concern about the use of Septicaine with epinephrine.
If there was a note from the physician, let's say the OBGYN, that said patients pregnant do not use epinephrine, and he used it, I would say there's a huge chance that there's a breach of the standard of care there, because the dentist does not have the knowledge, understanding, and expertise of the specialists of the OBGYN. So there may be another reason that the gynecologist did not want that patient to have epinephrine.
And I wanted to give you an opportunity to have your voice heard in this story.
No comment, sir.
Do you want to talk about Patricia Pachetti?
No comment, sir.
Dr. Charlap would not sit down with me for an interview about the swap in anesthetics, the violation of the doctor's order, nor his documentation. So I caught up with him as he was walking into work.
Can I play the tape for you where you're recorded saying that you switched?
Excuse me, I have to go to my office, sir.
Do you feel sorry at all for her?
No comment at this time.
Dr. Charlap's record keeping has been called to question in the past. I've discovered Charlap has been disciplined twice by the New York State Office of Professions, receiving a state suspension once in 2019, charged with practicing with negligence on more than one occasion over inappropriate documentation, failing to use a dental dam, and failing to inform a patient of a perforation. In 2021, he received a state suspension again after admitting to failing to complete continuing education coursework in documentation and risk management. In 2022, Medicaid excluded Dr. Charlap from the program as a result of the state's actions. When a provider's unethical behavior warrants their removal from the program, they are placed on the exclusion list, the Office of the Medicaid Inspector General says, damaging both his finances and reputation, considering almost 40% of New Yorkers are on Medicaid.
One of their criteria is that they don't want a suspended license.
But the documentation problems don't stop there, hitting home for Carrie as well. Her son was a patient of Dr. Charlap's.
My son has 2 bad root canals from him that he left broken files in. Both teeth need to be extracted.
You can see the broken file here in these x-rays included in Carrie's son's file. But Dr. Grossman says notes of the broken file do not appear in his chart.
If this happened in my hands, or if this happened in the hands of an ordinary and competent dentist, and the file broke, the protocol is to chart it. That is something that I did not see in the chart notes. So if this was a malpractice case, I would be critical of this dentist for not charting the broken file, because it is evident in the x-ray. So that would be the breach of the standard of care, which is the legal technical term for malpractice, is that when you see something that is abnormal, you must note it.
In addition to state disciplinary action against him, Dr. Charlap has been named in 2 malpractice lawsuits in the last 10 years. In 2014, he was accused of failing to use reasonable care and precautions in examining, diagnosing, and treating a patient. That case has been settled. In a 2019 case, Dr. Charlap is accused of negligently and carelessly breaking, cracking, or otherwise damaging one of the patient's wisdom teeth without telling the patient of an attempted but unsuccessful wisdom tooth extraction, but billed the patient's insurance for dental work, according to the suit, causing the patient to expend additional costs relative to his subsequent dental care by other treating dentists and dental offices, and resulting in denial of benefits from his insurance carrier. The patient, according to the lawsuit, was painfully and seriously hurt. That case has also been settled. Despite all of this, Dr. Charlap is still seeing patients.
I want him investigated. I want his records gone over. I want him inspected.
Carrie says she submitted complaints to many different oversight agencies, even doing so before she was let go, submitting a complaint to the Office of the Medicaid Inspector General and the State Education Department about Patricia's care in particular.
What he did to Patricia was the final straw. It's just horrible that a human being could do that to another human being and care nothing about a life, about a fetus, about a baby, about this girl that tried so hard to get pregnant, and he didn't even care.
But is it going to go do anything to the fetus? The answer is no. Okay? They just don't want us taking chances.
What do you think should happen from here?
As a trusted healthcare provider, you're not supposed to do anything to cause harm to a patient. Why would you do that? I feel like his license needs to be stripped away from him, because if he's done it to me, he's done it to other people.
Patricia says her pregnancy is going well and is looking forward to her son having a sibling. But if not for Carrie recording that conversation with Dr. Charlap,
What I did isn't allowed.
Patricia feels Dr. Charlap would not have been exposed for treating her against doctor's orders, and she would have been none the wiser.
He's disgusting. He needs to be taken down, shut down. Nobody needs to go to the office.
What would you tell Carrie?
Thank you. I would tell her thank you. I can't thank her enough for reaching out to me, being honest, and giving me everything that I'm aware of now, and walking down this hard road with me. It's scary, and I'm glad that I don't have to do it alone.
The state keeps complaints against a licensed professional secret until there's action taken by the Board of Regents. So there's no way to find out how many other complaints there have been against Dr. Charlap that have not resulted in disciplinary action. I've also reached out to the state education department to understand why the dentist was given a state suspension, allowing him to continue practicing rather than suspending him altogether. They are yet to return my repeated requests for a statement. Finally, I've learned the state attorney general's Medicaid fraud unit also knows about Dr. Charlap settling with him over a billing issue with a patient. That settlement was for almost $30,000. I'll stay on top of this one for you. For the 7 News I team, I'm Ed Dranch.